I'm Charles Bankhead of MedPage Today, reporting from the San Antonio Breast Cancer Symposium. Patients with locally advanced or metastatic breast cancer had no significant improvement in progression-free survival when the targeted agent sorafenib was added to paclitaxel. Secondary endpoints from a multinational clinical trial did favor sorafenib plus paclitaxel versus paclitaxel alone, as discussed by Dr. William Gradishar of Northwestern University in Chicago at a press briefing.
As I said, it was a randomized phase 2 trial. The accrual goal, as was true of most of the other trials, was around 220 patients. The patients were derived from India, the United States, and Brazil. And the randomization is, as you see, patients all got paclitaxel on a weekly schedule, and then either received sorafenib, which is the oral agent, or placebo orally. And the primary endpoint of the study was progression-free survival. These are patients with largely metastatic disease or unresectable locally advanced disease that could not have received prior chemotherapy for metastatic disease, although adjuvant therapy was allowed, including taxanes if it was more than a year before. And patients were assessed by the investigator and done so every 8 weeks for 24 weeks and then 12 weeks thereafter. And this is the primary endpoint of the study, which is progression-free survival, which suggests that there's an incremental improvement with the combination of sorafenib and paclitaxel compared to paclitaxel and placebo, representing about a 21% reduction in the odds of progression or death. The other endpoints that were evaluated were objective response rate, which favored the combination of sorafenib and paclitaxel, 67% versus 54%, meaning the fraction of patients who had some tumor regression, and the duration of response in those patients who did respond was longer in those receiving the combination of sorafenib and paclitaxel.
A second study reported at the meeting did show significant improvement in progression-free survival when sorafenib was added to capecitabine. From the San Antonio Breast Cancer Symposium, I'm Charles Bankhead, MedPage Today.